Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. Tell me what's going on. What happened?
Well, many years ago I had a torn meniscus, but I didn't know until maybe a few years ago, and my knee was starting to bother me. I got
Medial or lateral?
medial.
Okay. Medial is inside meniscus. Susanne is a PT, so that's why we speak different language.
And so I had an MRI.
Okay.
And then a few years later I had another one. They said it's extended into the left.
So medial and lateral.
Yeah.
Yeah, both meniscus.
Yeah.
How did you torn them?
Well, it was during a martial arts training.
Okay. So what your current symptoms?
Well, now I don't have full range of motion of my knee.
So knee extension.
And flexion too, like this.
So we're gonna take the range of motion.
See, that can completely go here. This only goes
Not too
that
much.
far.
We're gonna
And
measure
I can
that.
really feel it.
For how many years?
And puffy. It's been bothering me for a couple of years now.
Okay, 2 years. So can you tell me what kind of treatment you had it on your knee?
I had physical therapy and it didn't do any good.
I'm a physical therapist.
I'm a physical therapist.
Okay, what else?
And then I do various things like I put on just like home remedy compresses and things like that.
Yeah.
And
You did not have the full range of motion yet. Do you feel pain there?
the one time I had the full range of motion was when I went to a demonstration for PEMF, and I had a treatment on my knee, and I had full range of motion when
But you had one session and...
one session, and
you were...
lasted a couple of days.
Okay. So you might have some information.
Yeah.
And, well, you did not have soft tissue release, so we'll do
Right.
that. All right, so what is difficult for you to do and how much pain, other than limited range of motion?
The pain is very infrequent, but like one night I woke up, this is really weird, like about 4 months ago, and my knee, I was in full spasm of my entire quad. And it was so painful, and I was so delirious from it, I almost called 911. I didn't know what to do.
Yeah.
And then it calmed down, and it took me maybe a week even just to be able to walk up and down stairs.
Okay.
I'd have to do 2 feet in one step.
Wow. Are you still doing that?
No, that's much better. That was
how
like,
we aggravate your symptoms now?
Well, I work in a nursing facility, and I'm on my feet a lot, and lifting people, pushing people. So sometimes my knee feels like it's going to buckle.
Is it like if we want to aggravate, can we aggravate it with squatting or lunges or anything like that? Or you have to hold weight? How we stimulate your symptoms so this way we can see your response
Now,
to the treatment?
Oh my God, how can I stimulate my symptoms? Well, I can't really balance on this leg as much,
Okay.
and the right leg is much more solid.
Okay.
So that's one thing. And then when
Any pain with that on squatting?
no, I feel like my knee is like not stable when I'm doing this.
Okay. All
I
right.
feel like it's not stable.
But any pain or just the tightness, limited range of motion?
There's no pain right now.
Okay.
Yeah, it's so weird. It just comes and goes, and
People feel better when they see you. Let's lie on your back, head here. So we're gonna take the range of motion for flexion extension. This gonna be in the test. You guys remember the numbers. Push your knee down. So her extension, as you see here, it's like -6 degrees. So just like 6-7 degrees. She's missing 6-7 degrees here with the extension. Okay. So let's bend it. 1 second. Alright. It's almost like 132 here. But the normal is 145. She might be able to go to 150 or full measure. Where do you feel the tightness?
I feel the tightness a lot right in here. And you know, when I just bent my knee up like that, I got a whole muscle spasm all down the inside of my leg.
We have a table, please. When you get it there, how much?
When I get it there, it's kind of, it's a sharp pain, and I'd say it's about a 5.
And when you bend your knee, where do you feel the pulling? Front, back? Where do you feel it?
I feel it in right above my patella.
Above your patella, okay. Are you paying attention to the questions?
And if you notice too, on the outside of my left calf,
Uh-huh.
I have a long scar from when a wrought iron fence fell on me and cut my
Left
leg wide open.
Okay, this one you're talking
Yeah.
about? You see this? When did you have that?
That was when I was 20,
Okay.
22, a long time ago.
What's happened? You said what fell on you?
Yeah, I opened the wrought iron gate and it wasn't fastened and it fell and it just split my whole leg open.
Did you fracture anything?
No, and I got a great surgeon. He sewed it up, he cut tissue out to align it really well. Look at that, beautiful, and it actually went that far. And if you see my leg,
What's happened here? This
well,
is
it was
new.
my car, getting stuff
Just
in my
recent,
car.
now?
And my leg, see, this one is straight, but this one kind of curves a little bit.
Yeah,
here.
you see that here?
Yeah,
Okay. Yeah.
and I don't know what
Let's
that's
pull this
from.
up.
Do you think that could be from me? I'm like crossing my legs a lot when I was younger.
Could be or could be genetic, you know, going this way, I don't know. Did you notice that
It could be,
when did you notice it?
oh, I've had
Maybe your
it
bone alignment or,
for many years.
yeah. Yeah.
And I don't know if that's the bone that's curved or if it's from my joint.
Do you see what I'm doing? Make sure it's pain free, okay?
Yeah, that, right?
I
Yeah.
found it. I lost it. Just stay tuned.
It will be found.
Yeah.
And I'm remembering more things now.
Go ahead.
The other thing that happened to my poor left knee is that I was walking down the steps and the bottom step, it collapsed. And I went flat down on my face. And where did all the force go? On my left knee.
Multiple trauma.
What?
Multiple trauma.
Yeah.
Do you see what I'm doing?
They're pushing
That
down.
really stings.
Oh, sorry. Okay, make sure you say something, okay? Yeah. Is she still smiling?
Yeah.
Make sure she's not crying, okay? Alright. Make sure you breathe, okay? I cannot hear your breathing. And it's not painful. How's that? Are you comfortable in the stomach?
Yeah.
Okay, let's turn over.
Yeah.
Is that too much?
No, it's sore.
Oh, what about here? That's not too bad, okay. Let's check this. Actually, that's actually not bad. Is that too much?
No, that's fine.
Okay. And I will show you the scar tissue. This is gonna be a good map to see it with the A3. You can hear this. You really can hear it.
I can feel it, yeah.
Yes.
Can you hear it?
I can feel the bumping, all the
Yeah.
bumps.
You hear that? Slow. This is a slow motion. Actually, it's my hand that's slow. I don't know how to slow motion, but we'll see. Like boom, boom, boom. There's nothing wrong with my hand. It's the scar tissue, okay? I am perfect. Not anymore. It's all in here. Let's see her calf. Okay, I'm doing the same thing on the calf, just not too bad here. Make sure you say something, okay?
Okay, it's okay.
You breathing, yeah?
I'm breathing, yeah.
I will trust you too, that you're breathing, okay? I'll take your word.
Right there.
So that shows you how bad the area. So you get a feedback from the tools, the vibration, the color. So you're not gonna miss it. So it's going down, I'm doing here IT band. Okay, we'll clean this up and you can see were the problem. And the second treatment, third treatment, if you take a picture of these, you will notice it's start to shrink. So that's a good sign. If I had it like was really patient that really had it all red, and I like to, I ask patient if you really want to take a picture on your phone, so we can compare. Some people like that, and after a couple of treatments, you look, it's amazing. It's actually a good way of documenting. Lie on your back. Oh wow, look at that.
Need some more lotion over there.
Lotion, and it's a big one here actually. That's a big scar tissue. So, it's a big scar tissue here, and you probably will hear it here. But if I'm gonna do it, this is actually not going with my pressure, so I'm actually clearing it to pass this one to decrease the pressure. That shows you how thick her scar in this spot. The peroneus could be a problem for a lot of patients, but you know, and where is the problematic area? Okay, I want you to bend your knee and tell me, do you get the full range of motion or not yet before measure it? Bend it. How's that?
It's better. I'm feeling a spasm right here,
Okay.
right in my adductor.
Okay. It's okay to work on it? Okay. You have to ask. That's not bad. That's not bad. What should I do next?
Dehydrated, I think.
Relax. Let's get her some water, please. Oh, sorry. You okay?
Yeah,
Is that
Yeah.
painful?
that's the spot, yeah, right
Okay.
there. That's
Okay.
the spot. I forgot about that.
Okay. I forgot too. What happened here? Did you injure it? Did
Oh,
you
I-
injure your hip flexors?
Could have been
Mm-hmm.
when I fell off of the trapeze, or when I,
Oh. Oh, so a lot of trauma, so really we don't know which one, so I didn't
Very
go over
active.
all the history. And which injury you had really contusion and you really like, this took time to heal?
Well, I had, when I was little, like, the bike broke and I fell on my face and I was unconscious. And I,
You hit your head.
yeah, flat on my face,
Oh,
Okay.
yeah.
Okay.
And
Let's
that
get
was-
you some water and we'll do more work.
That was one thing.
Okay, keep going while you're drinking. You okay?
Yeah, it's like, ooh, I'm right in here.
Okay, we're gonna get to that.
But I did hit my head, of course, when the bike broke and I was
Yeah.
flat down on my face in the street.
Wow, so you had concussion for how long?
Well, I was unconscious, but I was unconscious and I ran next door to our neighbor's house.
Oh, wow.
And I was still blacked out, I didn't remember anything.
Well, you're a survivor, okay? Yeah. No, that's, you're lucky. Okay. Okay, we'll get her more water, please. Oh, she did not finish hers, okay. Want you to finish your water. Okay, sit up for me and tell me how that feels. Let's relax. Let's relax. It's okay to touch your hair?
Yeah, anyway.
I'm not tickling hair, that's not my goal. Is that painful or ticklish or just
Oh.
tender?
I have had a few broken ribs, but I never got an X. I forgot.
Case history
I
finally
don't
comes
pay
out.
attention.
All of
I
it.
forgot to, is it okay to work on the stomach?
Absolutely, yeah.
Okay, and the skin?
Yeah.
Okay. What else? Let's keep going.
I don't think they might come out.
Yeah, what else? What? So you fractured the lower ribs?
Well, I don't know, because I knew they couldn't do anything for it, so I never bothered to get an X-ray.
But where do you feel the pain?
It was down in this area.
Okay, what else? How did you fracture anything with this? What else did you hit?
Okay.
You see, that's
I felt-
probably 50% of the picture you're gonna see.
And I'm
Because it's
physical-
happened long time ago, so like there's nothing to remind them about it. So it's
Yeah.
yeah.
Well, in 2012, I
Mhm.
parked the car really close to the garden, and I was working in the garden in it.
Mhm.
I walked behind there, kind of threw me off,
Mhm.
and I tripped and I fell on a concrete
Where did you
slab.
hit?
I hit my my left wrist and I
What
broke
happened?
it.
Where?
That was 2012.
No, where you broke the
wrist? It was like right in here, but I didn't have to have
Do
surgery.
you have osteopenia for osteoporosis?
I actually, well, I do, but that was a hard fall.
Yeah.
But I did have I do have it in my spine and hernia in my hips and
Wow.
in my spine.
So, what happened here again?
I was going down the steps and it was in the winter and it was snowy and I think the snow had gotten on the steps. And my feet went up and I fell, full impact right there
Yeah.
at the edge of the step.
Yeah. Did you fracture anything?
No, well, I never went to the doctor.
Yeah.
I just put ice on it.
Okay. What else?
Not that I can
Are you
remember.
clumsy?
What?
Are you clumsy?
No, I'm just very active
Okay.
and I probably move too fast.
Okay.
Yeah, I'm still feeling something in here, but it's more like a 2 or a 2 now.
Okay. How much it was before?
It got up to a 6.
Okay, bend your knees. How's the bending?
It feels like it's bending more.
Yeah, it's bending more. Straight. Straight your knee.
And what?
Straight and sit up.
Okay.
Spasm or it's gone?
It's still in there.
How much from 0 to 10?
I say now it's like more like up to a 4.
Okay, turn around. Please. Nice and tall, sit up nice and tall. Anything else?
Not that I can think of right now.
Okay. And you fractured those ribs, yeah?
I'm sure I did, because it was so painful like for a while.
And then you say deep your hands. Okay. Let's lie on your back again. Try it again and tell me how this feels. Bending.
I'm still feeling a spasm in here and pain in here.
And pain again. Okay, relax. Hold your toes together. Hold it. Don't move. Relax. Yeah, relax. Push your heel down. Push. Relax. Okay. Pull your toes toward me. Dorsiflex. Your toes. Yeah. And relax. There we go. Let's turn toes in again. You guys know what I'm doing, yeah? Okay. So.
No, I don't.
You don't? Okay, we'll get back to this. Push my hand down. Wow. Very tight. We need to work on your back. We need to work on your back.
That's better than that. There.
You're not jumping.
No.
Very good case. Okay, try. Bend your knee again. How's that?
Better. It didn't feel too bad.
Okay.
There's still a little something going on there.
Okay, I'm gonna work on that. Let me get the goniometer. Do you guys remember the number?
172?
132?
72?
32.
32, yeah.
132
And 6.
and 6. Okay.
Negative 6.
Negative 6. Yep.
That was
Push down your heel. You guys see that? It's almost 0. Here. You see that?
Yep.
See it in the camera?
Yep.
Okay. 132. Okay, you see that?
What's it at?
145.
normal range.
Normal range. Yeah. Okay. Sit up and tell me how you feel. Bend and move around. You can stand up and tell me how is that. You can stay. We'll stay here.
It's good, it's
Yeah.
good.
Yeah. How's the knee?
The knee feels good.
Yeah. Yeah. You can do this. Let's see. Just move around. Yeah.
And my calf is touching my thigh more, I can feel.
So you can touch. So and sit down and tell me how's your hip feel. There's other work we need to do up here. Yeah.
It just still had a little touching here.
Oh. Lying back. I thought we were finished.
Oh my-
Here, thank you. Is it painful?
Yeah.
Sorry.
I mean, it's okay, but that is a definite
Mhm.
fibrosis.
Is it too much?
No, it's not.
Okay.
Okay. I remember another thing.
Go ahead.
When I was in college,
Uh-huh.
I went to Boston State College,
Okay.
and I was coming down Huntington Avenue by Symphony Hall.
Uh-huh.
Actually, it came down, get the name of the street, I was going on to Huntington Avenue,
Oh, okay.
and I wanted to catch the trolley.
Uh-huh.
So I started running so I could catch the trolley. And a taxi stopped right in front of me, and they didn't pay the person first. They opened the door,
Oh,
and I
that's
ran
painful.
right into the door,
Yeah.
and I went up and over the car onto the
Oh.
sidewalk.
Where did you hit yourself? Oh my
And
goodness.
I still made the trolley.
Oh my gosh.
I went to college, and I was in so much pain. I called my mom, and
Are you guys counting how many travels you lost?
I called my mom, and I told her I had, I went to the hospital because the pain was so bad.
Where did you feel the pain?
And I think it was my left leg, and I had lumps down that leg for months,
Oh, contusion.
all down the front.
You're a survivor.
The door.
Wow, you should write a book. Man.
Wow, all these things just.
Yeah.
Oh, boy.
Probably next time, just write all your medical history. That will help us
Yes.
to work, So I had patient like that, and I was like, okay, homework. Sit down, piece of paper, just write where did you hit yourself, and bring that sheet next time, because might be more.
But if he went to the medical doctor, he would have learned a thing about her trauma.
Yeah, because I didn't remember any of that at the beginning.
Yeah.
It was just like it was archived
It's history.
right there. Yeah.
Yeah. Is that too much?
No, it's okay.
Okay, try again. How's that?
Just like at the very, very end, when they got right to this position, which I'd say is just like about a 1.
More water.
Yeah.
Let's give her more water, please. It's right in here. Okay, so lie down again and tell me how this feel. So now she did her exercise for sitting up. And how was that? Did you notice the speed?
And the way she looked at you.
Yeah. Again. Again. Let's do it
I'll do
again.
it again. Oh.
So we try to make sure everything's fine. So what do you feel now?
It's just when I settle into this,
How
This-
much from 0 to 10?
it's just like a 1.
Okay, I'll take 1.
Yeah.
So what do you think about ASTR treatment? You just experienced it on yourself now.
Well, it's the first thing that's given me any kind of relief.
Yeah.
And it's the first thing that's enabled me to manually, to increase my range of motion. And see, the thing about the PEMF is that it may have helped with the elimination, it gave me more range of motion on that time, but it didn't change
You have
any of
a
the
scar tissue,
architecture.
you have fascia
Yeah.
restrictions.
So they need
Fascia
to
restrictions, trigger point, muscle spasm,
be, yeah.
scar tissue, you need mechanical force. Yeah.
So really, without doing this, I could get all the treatments that I want, and they're not going to do any good.
Yeah.
So I'm going to stick with it.
Yeah. Awesome. Thank you. Thank you so much.
Okay, thank you.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.